And welcome back. It's 9:15 here on this Wednesday morning. Obviously, health experts are keeping a close watch on the number of COVID cases locally and across the country. But now add to that the start of flu season.
Yeah, here we go. It's recommended that everyone get their flu shot from 6 months all the way up to senior citizens. Joining us this morning to give us our flu shot is registered nurse Terry Wilson. Good morning, Terry.
Good morning.
Thank you so much for coming in and doing this for us.
Thank you for having me.
It runs the gamut. We got 6 months to senior citizen over here,
okay,
so it works out well.
Stop.
So we do talk about who needs to get the vaccine, and especially now with with it coming up and the weather changing and everything, who is recommended?
So almost everybody needs to get their flu vaccine 6 months and older, and ideally they get it either in September or October.
Now, there are different flu vaccines for different ages.
Yeah, so well, there's a few different flu vaccines. There's just your standard one that most people can get. There is a nasal option, which a lot of parents find beneficial or easier to give their children. There's also a flu vaccine for people with egg allergies, so it's egg-free. And there's also one for adults 65 and older.
Those are all important things to be aware of.
That's
sure.
really good. So the cost, people, of course, with healthcare, how much does it cost? How much does it cost? So how much does it cost and where can I get it?
So most private health insurance companies and government plans will cover it at no cost to to whoever they're covering. Also, you can contact your local health department to see if they have a supply of low or no cost vaccines if you don't have health insurance. If you pay out of pocket, it's generally $25 to $40.
I know a lot of people are saying, why is this important? And I think given the situation with COVID and that vaccine, I mean, there are a lot of similar symptoms. And so you're like, which do I really have? Why do we want to make sure that we've got our coverage for the flu?
Well, number one, to protect yourself and maybe to take a burden off the healthcare system with hospital beds, but also just to protect the people around you, especially our more vulnerable populations like children and older adults.
I used to be one that didn't get the flu vaccine, and because I thought I was really strong and healthy and didn't need it, and it just takes one time to get the flu to realize that any protection that you can get is important. Now, the flu shot doesn't guarantee that I won't get it.
Right, but it significantly decreases your chances of getting it, and even if you do get the flu after having the flu vaccine, your symptoms are going to be way less than what they would be if you didn't receive it.
All right, I think the time has come. I don't think we have any shot-giving.
I was going to say we've got the flu vaccine for me, and then there's one for you. Right.
Go ahead, Dave. Roll up your sleeves.
Yes, I'm going to go because
first.
she had to ask you your age, and then
it was really sweet, and that's
I was
why
just trying to make an age joke.
Gotcha. Well, I think that's what was really important is she was very kind to say, I think I got the right vaccine because you might look younger than you are, or some people might look older than they are. I, however, am under 65, so she brought the right vaccine. So this is just one quick stick. Normally she would be giving us suckers and lollipops, but she left those in the other room.
We also asked that in the commercial break. Did you bring any suckers? I don't know. The reason that I get the flu shot every year, I was the same way, LeAnne. I never really got mine, didn't really think maybe it was important or whatever, but I just kind of played it percentages. So even if a vaccine is 40% effective or 30% effective that year, because there's years where it's not as effective, I just figure I've known enough people with the flu to know it's absolutely miserable, and if I can just, even if it's a 40% chance, I'm just going to do what I can to say, at least I tried.
Okay, I'm up next.
Okay.
See, we're just going right from one to the other. We've got
nothing.
about 10 seconds left. She's going to change out her gloves, which I do appreciate. And again, if you have not gotten the vaccine, because really we're just getting into the start of the flu season, probably from now through the mid-October is when you're going to see a lot of advertisements. I know a lot of the local drugstores have them available as well. A lot of times you can go to the same place where you get your COVID vaccine as well. So anyway, if you want more information, we'll post a link on our website to the Tulsa Health Department. 1, 2, 3.
Stick.
I'm a very big girl. Now, you probably have a little bit of pain at the site. That's one of the symptoms. But a lot of people say, oh, I just felt sick. I felt like I had the flu afterwards. That's really just your body reacting to the...
Right, that's your body building up antibodies. And sometimes I've even heard of people catching the flu before they even get the vaccine. It has even a chance to cover you. So.
Gotcha. Great. Terry,
Thanks,
I know it's a lot of
Terry.
stress to put this on someone, but thank you very much for doing this live. We appreciate it.
You're welcome. Thank you for having me.
We feel protected. All right.